right. Well, good afternoon, everybody, and welcome to this month's Cancer Wellness Center staff chat. For those of you who are not familiar with me, my name is Priscilla Andrews. I'm the clinical manager here at the Cancer Wellness Center. The staff chat was designed as a series to give our participant community some insight into conversations among professionals talking about topics and issues and concerns relevant to the cancer community in our area and beyond. And I am very pleased this month to have not one, but two of my esteemed colleagues joining me here. I have Kimberly Matthews, who is our support services coordinator at the center. Hi, Kim.
Hello.
And I have Dominique James, who is one of the clinical associates here. Hi, Dominique.
How we doing?
Yeah, good.
Glad to be here.
Yeah, thank you. And I am both excited and feel a little trepidation here because we have decided to switch it up a little bit this month. While Kim runs our significant others groups that are primarily spouses and partners, it's Dominique and I who have experience working, running adult child caregiver groups. So Kim is going to be slipping into the interviewer role, and I am going to be slipping into the interviewee role. So I get to know what it's like on the other side here.
Nothing to be nervous about. I'll be gentle.
Oh, thank you, Kim.
Yes.
Thank you.
So if we can start with both of you just telling us a little bit about what got you interested in working with adult child caregivers at the Cancer Wellness Center. Whichever one of you wants to start.
Certainly, I'll hop right in. So yeah, I guess what's interesting is, and with the group that I'm running, most of the members are around my age. I'm 31, and so there's this sort of peer-to-peer connection there. But I also have several friends, and I've taken care of a grandparent with cancer, not a parent with cancer as yet, but I do think that of the sort of roles that do exist as far as like the caregiver dynamic, I found that with my clients who were, the children of a parent with cancer, whether it was terminal or non-terminal, it's something I was always interested in exploring with these clients, just as far as seeing, how are they functioning? What does that dynamic look like? How does it sort of shift even? And what are the sort of parameters that allow it to be more successful with some children and more challenging with others? And it seemed to be something that came up quite often. So I'm glad we were able to start a group eventually.
Yeah.
But yeah, that's my little response.
Ah. And I think I'll probably echo a little bit of the sentiment that Dom shared. I will say early on in my work at the Cancer Wellness Center, and I think it just was by happenstance, the majority of my clients were caregivers, and out of that, a majority of them were adult children. And I have personal experience with being a caregiver for a parent long distance. I will acknowledge that. And I think there's just such, it's a unique, they have unique needs that are differently situated than spouses and partners.
Mm-hmm.
In some ways of similar complexity, in other ways, I think of even a higher degree of complexity to be a caregiver as a child. So I think that's what prompted starting the group. I ran a group prior to Dom running a group. I think that's what prompted feeling like there was sort of a need, because it can be rather isolating, especially I think, Dom, as you mentioned, for those younger adults who may or likely may not have peers that are mirroring their experience.
And I think there are so many, well, obviously there are so many variations in the caregiving role, and particularly among adult child caregivers. I've worked with 70-year-olds who are adult child caregivers for their parents in their 90s.
Yeah.
And 20-somethings who are in that caregiving role. And of course, the caregiving role can be actual physical care. It can be emotional support, financial support. managing the household, advocating with the healthcare team. There's so many possibilities. And Priscilla, you mentioned being a long distance caregiver. So sometimes you're in the same town, sometimes you're in the same home, sometimes you're long distance. So just because there's all of that variation, I'm wondering, how do you talk with your adult children clients when they're in these variety of roles? What does that look like in a group when there's that variety?
I mean, I can hop in if that's okay. I mean, I think first off, to just acknowledge, I think that is, with any group, there is a variety of presentations, but I think that is certainly one of the things that can make the adult child caregiver group a little bit more complex, to be honest, because, I know when I ran the group, I had people that fell into each of those different instances, as far as, stage of life, as far as where they were living, proximity, what their role was. I think the common thread among all of them is, what is it to navigate the parent-child relationship when some of the ways that relationship functioned may be forced to change because of the diagnosis, because of the disease and the caregiving needs, paired with, I think there's the relationship with that parent. If there is a partner parent, another parent without cancer, that's very complex. And then I think beyond that, the family dynamic very much comes into play. And I think that I saw reflected regardless of stage of life, where the child was living, how close they were, what their role was just sort of how to navigate these new relationships alongside of coping with, any sort of anxiety, fear, anger related to what's going on with the parent's illness. Your furry friend.
Yeah, I thought I'd fix the angle, so that wasn't possible.
That's okay. Are they camera shy? Is that?
No, they're definitely not camera shy. I just didn't put the makeup on them. So yeah. So we need some powder. But to touch on what you were saying, and I think we discussed this previously a little bit. Just sort of the nature of the varying roles, right? And how does one who's been cared for their entire life sort of switch roles and completely sort of switch that dynamic while navigating through all of this sort of, discomfort of a natural sort of family hierarchy, right? And so how does one who's taking care of their mother, for example, I'm thinking of someone in my group, and while they're both in later adulthood, there's still, and both have, children, have lived fulfilling lives, what have you, but still there's this challenge of one telling the other how they need to sort of care for themselves, while, I think some of the other variables that go into it, such as, what is the parents' level of interest in their treatment plan? Are they involved in any sort of mental health care routine? Are they able to drive themselves, and how mobile are they? So I think that often when these children do run into these challenges and have to juggle their own sort of life work balance, what have you, it's extremely challenging, and I don't think that enough of the sacrifices that have to be made are acknowledged initially or even understood. And I'm sure both of you have had some degree of experience with that personally.
Can I piggyback on something that you just brought up? Because I think it's an important point here, which is, I don't want in any way to come off as minimizing the challenges that spouses and partners have. While at the same time, I think when it is a child, I think there's often much more of an expectation, whether it be from social network, family, society, self-identified, of maintaining all the other aspects of their life while also adding on to it the caregiving role. And that can be anywhere from I need to call my mom every day and check in and see how she's feeling to mom can't drive, I need to be at the appointments, she can't bathe herself, right? Very intense caregiving needs. And I think when it's a spouse or a partner, I think there's a little bit more awareness and sort of support around the fact that one's life may need to be reorganized around caregiving. Whereas I think that's a lot more complicated for adult children because they kind of have to figure out where they fit in there and may get a lot of different messages from people in their life about what they should or shouldn't be doing.
Well, and I think that's such a good point. The messages from the person who's ill, their own messages that they're getting, do they have a spouse? Do they have children? Are there siblings? Is there extended family? So navigating all of those relationships, I think would be challenging too, if people have different expectations. So given that, I'm guessing, or I'm trying to ask what your role is as whether it's a therapist when you're seeing these clients individually or in a group around whether it's communication within the family system or how to kind of get those expectations on a more even field, like so everybody has the same kind of expectations. How do you go about that?
Yeah, I think I think it really starts with, first off, the individual needs to sort of recognize where do they stand within those relationships, and sort of like how do the sort of family systems even function? Are they conducive to care? Do they have more to do with more of a transactional relationship where I cared for you, now you have to care for me sort of level, which I think sort of goes back to what you were saying, Priscilla, about the difference between spousal care versus this sort of like family or child parent dynamic where there's an expectation, right? And even I don't even have kids yet, and I already expect them to take care of me when I eventually start to wither. And so and whether that means sort of looking at the dyads or the triads of how the little pockets within the family, and depending on if you're an only child or if there are other siblings, how do you even begin to negotiate? I suppose, and we were talking about this yesterday a little bit, if you're the oldest sibling, maybe there's that expectation that you're the one who's sort of going to take charge, or if you're the really responsible younger sibling, who we were definitely talking about yesterday, maybe it's your turn to sort of step up, or do you have more or less responsibility? But I think that what I've noticed, at least with my group members, is usually there are a number of assumptions made initially, and eventually that leads to a productive conversation. But we kind of just fall into the positions that we've been working within for a lifetime, right? And I don't know if you've noticed this with your clients, Priscilla, or with.
Yeah, I mean, you started at the exact starting point I would, which is I think just the starting with the individual and trying to explore like what are their expectations of what their role is or roles are, and how does that match up with what they want to be doing? How does that match up with what they're able to do? How does that match up with what they feel like the family expectations are? What the parent with the diagnosis expectation are, if there's another parent, what their expectations are, how does that fit into what messaging they're getting from their siblings, if there's siblings in the situation. And I think after understanding what the expectations are, what message they're getting, then I kind of want to understand where is that message coming from? Where are they getting that cue? Because sometimes the cue they're getting is very explicit, right? Like, the parent is saying, I need you to be here at this time, and I need you to take me to the doctors, or why don't you call me more often, right? I mean, there can be something, or like, oh, I'm too busy with my family and you don't have kids yet, so can you make sure to take mom to the grocery store, because whatever it is.
Mm-hmm.
Sometimes the cues are less explicit and are more based on assumptions. And I always say, like, those assumptions could be anywhere from 0 to 100% accurate. And I can't know that because I don't know your family. So sometimes it is a matter of kind of investigating those assumptions a little bit more deeply. And then I think with regards to communication, wanting to understand, like, how has communication worked in your family in the past? Some families have different ways of handling communication. Sometimes it's very one-to-one, and it always works that way. We don't all get together and conversations are between people. Sometimes there's like the identified communicator. I certainly can think of a case in particular where mom was the one with the diagnosis and she was sort of the hub of the family. And so there was a lot of challenge because information wasn't being distributed the way that it normally would. And the family had to reorganize of, like, if mom's not directing the traffic per se, like, how do we figure that out? And I think part of that too is, if it is a new way of thinking about talking, first off, like, what can the client, the person in front of me, and their family tolerate as far as a different way of communicating? And also to acknowledge, like, that you may be called to task to be doing things differently that you've just never done before, right? A lot of families, they don't talk about the rules in the family. They don't talk about the roles in the family. Like, that's both the difficult part about families, but the beautiful thing about families, right? Like, I don't have to say to my husband, take out the garbage. That's his job, and that works out great, right? But then, to use that as example, like, what happens if he's sick and he can't take the garbage out, but we've never talked about it, and then all of a sudden our family is trying to reorganize around who's going to take the garbage out, except multiply that tenfold, depending on what roles and how limited the person with the diagnosis is, and how limited the other partner is, right? How limited the other parent is, because that comes into play. Because sometimes it's, I can think of one person where, yes, there was the person with the diagnosis, but the other parent, to your point earlier, Dom, about mental health support, the other parent was struggling, not willing to get support, and not even able to perform the things that would have been taken for granted. So now that child has two parents that they're trying to figure out how to negotiate, what to step in with, and how to address that.
So what I'm hearing is that often communication around that can be helpful, right? That sometimes this is just implicit. It's the way the family's been functioning for decades. And so people just step into roles naturally, but there are lots of complicating factors potentially when there's a diagnosis. I can't tell you how many times over the years I've seen families where it's just all the adult siblings coming in because a parent has cancer and help us figure out what questions should we be asking, what should we be doing, how do we divvy up the roles. And it's very individual by family, as you're saying. So sometimes that happens relatively smoothly. Sometimes there are extra challenges because of whatever family dynamics were going on prior to this diagnosis.
Can I say something along
Yes.
those lines too, which is, I think we can often get focused on, and understandably so, when we're working with somebody who is dealing with dysfunction in their family. And of course that is challenging and has its own complexity. But I think even in families that are high functioning, that family meeting that you're talking about, Kim, like, that could be a very high functioning family. And so when this happens, they just don't know how to talk about things in that way because they never have had to do it. And so, I always say, like, even families that are loving and caring and have the ups and downs that all families have, but don't have problems, quote unquote, are still going to be in a growth curve situation when it comes to the cancer diagnosis.
Right. And I think, when we talk about counseling in groups, sometimes people expect that, well, those are people who are struggling. Those are people who have problems. Those are people who can't figure it out. And that is often not the case. That oftentimes people reach out because they know how to get support. They know how to take care of themselves. And this is just one more way to do that. And they appreciate learning from others, but they might be very high functioning, and that this might be a very healthy family. And it's also a very emotional time. So even if the tasks are falling into place, there's the reality now of the emotional,
Yeah.
the anxiety, the sadness, the fear, the grief. So tell me a little bit about that. How does that present itself, and how does that get discussed? Just that emotional impact of the diagnosis on the adult children.
Yeah, absolutely. And I think often, it can go anywhere from bringing the family together and acting as sort of an adhesive as they all sort of band together in the face of this challenge, or quite the opposite, where someone feels as though, they bring up maybe the family history of, oh, mom, you never treated me well, so I'm going to leave. Good luck. You always treated the other child better. And I've seen, both within the same group, and being able to sort of have a space to even discuss that openly. What the group does is creates a space to even say that, and maybe even have the time or presence of mind to acknowledge that a person may not feel as though their parent was worth that care, but then they can explore it, or then they can at least have some level of understanding within that group setting, process it, see why they feel maybe they didn't receive the care that they wanted, and maybe then open up a door for family therapy. But I think that often there's just so much pain within those groups, right? There's just so much confusion, almost I wouldn't call it desperation or anything, but you're working under duress, right? And you're working within a sort of set time frame of what is supposed to function in a certain way, how you're supposed to sort of coexist with your partner and your maybe if it's a two-parent situation, and quite often been noticing that a lot of times the one of the other parents who's I guess the spouse or partner or what have you, they often may not speak English. We work with a pretty international population, and so many times they're not able to sort of have those discussions with physicians, or they're not able to go in and speak with the doctors, or because of COVID, only one person is allowed into the office, and so often that becomes the child's role. And while they're in there and trying to receive this information, they're also stressed that they may lose a parent. So how are you able to sort of focus when you're on high alert, but also under these sort of extreme conditions?
Yeah. Well, and I think to piggyback on something that you said earlier, Dom, is that experience of distress that is, I think, even for adult children that do not historically have a good relationship with their parent. I think there can be an expectation that, well, if you had a crappy childhood or you had a crappy relationship with your parent, then you're just going to be disconnected, and it's not going to be as painful as thinking about losing a parent that you have a really loving and caring relationship with. But I do think that regardless of the quality of the parent-child relationship, there is the emotional experience of the prospect of losing your parent, right? Whether it truly is a terminal diagnosis or not. I will say, in my experience, the people that at least showed up for group tended to be people who had a parent with a more progressed diagnosis. That just was maybe happenstance. And there is an emotional complexity to that on both ends, right? Because on one hand, you have people who are experiencing anticipatory grief over the loss of their parent. And, depending on their age, sometimes that feels like the natural course, right? The parent is 90, right? But still the feeling of, I've had my mother, my father with me my whole life. or the opposite end of the spectrum, a child in their 20s who, honestly really still needs their parent, that there's still a lot of life milestones that they're having to envision their parent not being there for them. And then you have people who don't have a maybe historically a really good relationship with their parent, or maybe there's been a lot of ups and downs, and that is still can be the pain of, maybe sometimes it's inner pain of guilt or shame about not wanting to be there for their parents, and how do they navigate that intra-psychic experience, as well as, I think, something I talk about a lot is, when parents or relationships don't change in the face of the cancer diagnosis, and the sense of, kind of like, if not now, then when, and the grief over that lost opportunity. I think most people I've seen, I can't say all, but most people I've seen, even if the relationship has been really hard, I think it's really hard to let go of that hope of an improvement in that relationship. I mean, we're biologically wired to attach to our parents out of necessity, and that's very hard to let go of. And so to face the prospect that mom or dad is not going to change, the relationship may not change, and you are going to, if they're dying, you're going to lose the opportunity for things to be different, I think is very painful. And I think that's a unifying, even though the cause of the pain is different, I think that can also be a unifying element within group of coming together around that. It hurts to think about your parent not being here and not having that person in your life, whether it's how they are now or how you wish they could be.
So, I mean, there's so many emotions. What we settled on right here was the sadness, the loss, the grief, whether it was a happy, healthy relationship or a challenging relationship. The grief might come from different places, but that is fairly universal. We touched a little bit on, other, like, why people are in this role. Who else is in this role with you? If you have other siblings, if there are other extended family or friends, and what if there aren't? What if you are in this role because you're the closest proximity, or the one who is perceived by the family to, maybe you don't have children, so you have more free time, or your job is more flexible. So sometimes,
or you're an only child.
Right. Yeah. So sometimes there's resentment. I was thinking of, like, when there are other siblings, good, but maybe you are the only one. And still that can be hard, because you definitely have your own life, right? So how to navigate that when resentments come up, or how to pull in other supports if they might be there and just haven't stepped up, or you haven't asked. How do you navigate that piece of not having it all fall on one person?
I mean, I think I do want to say, sometimes there is a reality where it does fall on that person. And I think that does benefit from investigation, right? Is it a perception that it all falls on me, and so I just step in and I'm not asking for help and I'm not asking for support? But I can certainly think of a couple people where, no matter how we looked at it and turned it around, like, bleep was going to fall downhill onto them. Like, that was how this was going to go. And so, and that can be because of the availability of our family members. That can be because of being an only child. That can be because of, other family members being restricted in what they're able to do for any number of reasons. So I think that's when it becomes, from my perspective, and I'm curious to hear what you have to say, Dominique, because I feel then that becomes a little less about communication and helping them sometimes it's problem solving, but sometimes it is about how am I managing my stress? How am I taking care of myself? You know, what kind of emotional support do I have if I don't have task support? Sometimes if I don't have, you know, something I will often talk about with caregivers and patients is if the task support isn't available for the caregiving, could there be task support for other things in your life that would free up your energy for caregiving, that would free up your energy to do caregiving? And then, you know, instead of worrying about dinner, then I can go and I can read my book for a half hour, whatever it is, to think maybe more creatively about how to, even if balance can't be achieved, how to strive towards some balance and self-care. But I don't know. I mean, I'm curious, what say you, Dom?
I saith that in many cases, and I completely agree with you. You know, I think in it often it comes down to one individual, and whether that is because of those reasons you listed, such as, you know, they're the only child, or the other siblings live far away, or they're the child that doesn't have any children. Whatever the parameters are, you're stuck in this position, right? And so how do you then negotiate for yourself or within your sort of selective community, what sort of need you require, what sort of assistance you require? And does that mean, like you said, someone who brings maybe dinner once a week or helps out with your parents? Do you have friends or extended family who know your parents that would be willing to support you during this time? And I think something I've often discussed with some of the participants has been this sense of pride around asking for assistance, or you know, because I think community is something that's very foreign to a lot of us, despite us living in these, you know, like whether it's suburbs or neighborhoods, whatever, we can tend to be quite isolated. And so it's a very sort of foreign approach to have to reach out and say, look, I need help, because we're so used to being able to provide for ourselves, or our parents provided for us in a certain way that showed us, oh, you don't need help, you just need to work a little harder or suffer a little bit more. And I think what we're recognizing through the pandemic even is just how reliant on other systems or on social support or on whatever it is that any of us could be, and that it could be any of us in that position. And so how do we sort of strip ourselves of that pride?
Can I say something too?
Yeah,
Because I think
absolutely.
this goes back to something I said earlier, and I think that is one of the unique challenges for adult children, is that I think when it's a spouse, that social support is there. It's not always there, but I think that there is more of a recognition of thinking about, maybe this person needs a meal, maybe this person needs me to call and see how their spouse is doing, right? That, you know, maybe this person needs a break. But I think that idea of having to ask for support, I think spouses and partners certainly have to do that. But I think even more so for adult children, because it can be a bit more invisible, right? Like it's very feasible that they have people in their life, even like friends, that may not know what's going on because they don't live with their parents, they're married, they have a family, it's, you know, like it's friends from work that they may not share that with, in a way that a person with a partner or spouse may not have no other choice but to disclose what's going on.
You mentioned, Dom, that sometimes a person, for whatever reason, might be stuck in this position of being a caregiver. And I know sometimes people feel like they're stuck in this position. And sometimes caregivers talk about being grateful for the opportunity to take care of somebody they love, or wanting to be the best caregiver possible, and help me do that. Help me, you know, understand how to do this to the best of my ability, how to take care of somebody I love. So what do you see with adult children? If they're feeling stuck, how do they make a shift to feeling maybe less stuck and have a different way of looking at it? Or those who don't feel stuck and would identify it in a different way, this role of being a caregiver?
Yeah, I often find that it's a lot to do with you know, are we in a state where we're being reactive? You know, are we sort of feeling as though we don't necessarily have the time to recover? We don't necessarily have the either the assets or the protection to be able to feel secure in the job that we're doing or in our performance, or the child's performance. And so often that leads to, if they don't feel as though they're fulfilling their obligations or responsibilities appropriately, this leads to them feeling overwhelmed, which leads to them, you know, even questioning the level of care they're giving their parent. And often this leads to a overwhelming sense of pressure that the parent's life is within their hands, and if they're to fail in any way, there's nothing they can do about it, or there's that they've failed and they hold on to that responsibility, which I try to sort of dissuade in our sessions, because ultimately the virus is not the virus. I'm so sorry. The cancer is going to do as it pleads. I'm so used to talking about COVID.
And the virus.
You know, and the virus. You know,
Both
all of
together.
them. You know, but I think it's, and I'm curious to hear what you have to say as well, Priscilla. But I think it's, you know, giving yourself a moment's compassion. Like, I think self-compassion is just so incredibly important in those moments when you're recognizing, oh, I'm overwhelmed, or oh, I'm finding that I'm terrible at this. You know, like often a lot of the sons that end up in this position are males who often don't know how to give that care because we don't live in a system where guys are socialized to do so. They find that they're failing and they put that much more pressure on themselves. Or for the daughters who have been forced into this role, despite a son who may have more resources or freedom. So that's something that comes up often, how brothers seem to sort of not do the best job of caring for their parents within these sort of dynamics, right? And so how do we then create some negotiations around that, right? How do we sort of say, I don't want to sort of fall into the pigeonholes or the sort of stereotypes or archetypes within family dynamics that lead to, you know, the females doing all the care work while the guys do all of the sort of whatever guys do, you know, which I think is really abandoning their responsibilities or saying it's too hard. And so I think it's really important to open up those sorts of discussions as we navigate through these family dynamics. But yeah, I'm curious what your thoughts are, Priscilla.
You know, I think to just say something in response to what you said, I mean, I think that sense of I can't do it because it's too hard, because it's foreign, that we can talk about in a gendered way. I think that is common. I think we could talk about that across the board.
Absolutely.
You know, I think, you know, for me, I know you guys both know that I'm big on the nervous system. And so I think, you know, when I encounter that, or when I hear that, you know, it makes sense to me, right? You're in this situation, it feels overwhelming, it's foreign to you, and it becomes difficult to be curious about how you can show up for your parents. And instead, it is this anxiety provoking experience. And I think it is important to acknowledge the societal norms that we are living within, that for men can put them poorly positioned to feel like they have had role models or learning throughout their years to feel confident and competent in being a caregiver. And I think on the other hand, for women, you know, if they're feeling the burden of caregiving because of those expectations, I feel like that dynamic, I think, is important. It can be important to acknowledge that. I think, you know, kind of going back to your question a little bit there, Kim, you know, sometimes, number one, sometimes that resentment can't get worked through. There's just too much else going on, right? So like, I think along that self-compassion piece of, you know, I think especially if people feel like they should be more forgiving, like maybe now is not the time to be forgiving. And so how do we just work with that? I think is one thing. I think the other thing too is kind of going back to that nervous system piece of, you know, that experience of resentment and kind of being activated with resentment, right? Because there's a difference between, I can say I really resent that that person doesn't show up, and it is like a full body experience, and I am like so rageful about the fact that that person's not showing up or whatever it is. That shifts, and what state we're in is going to impact how we view the situation. And so that is very much, if somebody is having a really hard time having moments of peace, or having moments where they're not overwhelmed by that resentment, then I'm probably going to want to first off see, like, are there moments when that feels differently? Are there moments when, not saying that you have to think what is going on is okay, right? It's not about getting to a place where you say, oh, it's fine that that sibling's not involved, but do you have moments where you find yourself being able to be more forgiving, where you find yourself feeling more compassionate towards your sibling, or more understanding, to highlight, like, okay, so this shifts. This isn't a constant experience. And if not, like, are there resources available for you that can help you drop the rope on that resentment, even for a short period of time, so that it doesn't feel like it's consuming you?
Well, and I think that's the key point, right? That it's consuming the person who's having that experience, right?
Yeah.
Is that something that serves them well in that moment, or can they let that dissipate a bit?
And I will say along those lines, I think sometimes when that comes up, I think there is, I don't always use the term forgiveness with the person, but like, if we think about forgiveness, I think sometimes people, they feel like if they let go of that anger, that somehow they're condoning what the other person is doing, and they're saying it's okay. And actually, I had a student, I was recently doing consultation, and he talked about how he's working with a client who often said, it's okay, and instead working on shifting it to, I understand. Right. And so I think that sort of similar shift of that idea that if I drop this rope of the anger and the resentment, it's not about saying it's okay. It's not about saying that I don't wish it was different, but it is saying, I understand this is how things are right now, and I am not going to hold on to this and cause myself more pain than I'm already having to experience, more suffering than I'm already having to experience. Sometimes it's a tall task, and that's just not feasible. And just, how do I live with this, at least for now?
Right. So I'm noticing the time, and
it's always short, right?
It is. So we've already mentioned the adult child caregiver group that at the moment Dominique is facilitating. So if people are interested in that support, give us a call at the Cancer Wellness Center, 847-509-9595.
I like it.
We need a jingle.
It's like Luna. We need like Luna carpeting. We've got something that embeds itself.
Exactly. And we offer counseling. Oh, I see. Savina put in the chat.
There you go.
In our website. We offer counseling, individual counseling, family counseling. I mentioned earlier that I often work with families, adult siblings in particular, and those are often 1 or 2 sessions, right?
Yeah.
So sometimes people feel like that I've got so much on my plate already, but sometimes it's just an opportunity to come in, everybody learn how to ask each other questions, talk with each other about this, hear one another, so that you can get the support that you need within the family, and identify how to best go about this task of caregiving.
Yeah.
Anything that either of you would add to how to find support at the Cancer Wellness Center?
I think Dom's group. Wait.
Yeah, if you are interested, we meet every other Wednesday at 6 p.m. And I find that it's a great group. It's a warm place.
Still via Zoom, right? It's a Zoom. It's a Zoom
group. It's a virtual group. So yeah, please reach out and give us a call or shoot me an email at djames@cancerwellness.org.
Nice.
But would love to help you out or work with you.
Great. Well, thank you, Kim, for being gentle. I don't know who else will be back here, but I know I will be back here on April 13th for next month's staff chat on barriers in healthcare. I hope I got that right, Savina. So I hope you will join me for that. And I want to thank Kim and Dom once more for being here together with me today. So I look forward to seeing you all in the future. Thanks for being here with us today.
Thank you.
Thank you for having us.